Pharmac- Pharmaceutical aids. Pharmaceutical aids are a type of ergogenic aid commonly found as different types of drugs. For example, beta blockers, the human growth hormone, and anabolic steroids. They are drugs which are both legal and illegal, and they are used to try and improve an athlete's performance. Drugs such as beta blockers are used to calm nerves, whereas anabolic steroids improve muscle growth. These types of drugs are illegal. However, there are also pharmaceutical aids which are legal, for example, caffeine. Caffeine is a legal stimulant that athletes may use as an ergogenic aid. There is many studies which show effects within the aerobic system and also the anaerobic system, which are both used by a heptathlete as they compete in events such as the 800 metres, which uses the aerobic systems. They also compete in events such as the 100 metre hurdles, which uses the athlete's anaerobic systems. Caffeine is one of the most beneficial aids that can be used legally. Caffeine acts on the brain to lower the perception of effort, making it appear that the exercise you are doing is easier than it actually is. This allows athletes to continue working for longer periods of time. Another way that caffeine can affect the body physiologically is due to it stimulating the nervous system. Having a more responsive nervous system means that muscular contractions can be stimulated faster, which leads to the ability for muscles to fire and contract faster. According to Osland 2017, when caffeine reaches your brain, the most noticeable effects that occurs is alertness. This is because it suppresses the actions of adenosine. Therefore, the brain is able to create more neuroactivity, reducing drowsiness and fatigue. The muscular contraction process begins when the nervous system generates the first signal called action potential. This signal then travels through the nerve cell called a motor neuron. The impulse then reaches the neuromuscular junction where the signal is able to reach the muscle cell and the muscle fibers. Once this has occurred, a chemical message, also known as a neurotransmitter called acetylcholine, is released by the motor neuron and binds to receptors of the muscle fiber. This then stimulates a chemical reaction within the fibers of the muscle. As caffeine acts as a stimulant, it means that the signals in the brain are being more active. This then means that the signals travelling down into the muscle fibers can be produced a lot faster. This is beneficial for the heptathlete because during the 100 metre hurdles, muscles need to be able to contract quickly to ensure that enough power can be generated for the athlete to jump as well as sprint in between each hurdle. If the muscles can fire more rapid contractions, it means that the athlete can generate speed much faster, giving the athlete an advantage in the race. Having more efficient muscular contractions caused by the intake of caffeine would also benefit the athlete in events such as the shot put, which is an anaerobic event. Therefore, the muscles work without oxygen. As the athlete's muscles in the arm contract faster due to an increase of neuromuscular signals, it means that they should be able to generate more force and throw a further distance as the muscle is able to work more efficiently. According to Munson 2017, the dosage that you take should be from 2 to 6 milligrams per kilogram of body mass. Any more than this could affect your body negatively, which could be dangerous as it has side effects of serious headaches and making people have increased levels of anxiety. According to the same article by Munson 2017, caffeine shots are accessible for everyone and can be bought in small or large quantities. A large quantity of a 12-pack usually starts from around £27, however a small single shot begins at £2.25. Although the consumption of caffeine has positive effects, it also has negative side effects. One side effect is that the use of caffeine can disguise the fact that your body needs rest. This is a disadvantage for a heptathlete because of the amount of physical activity they have to do in a short amount of time. If the use of caffeine is disguising an injury or pain due to it being stimulating and making you want to exercise, it can mean that the heptathlete takes part in an event that they shouldn't, when they shouldn't. For example, if they pull a muscle, then decide to continue competing. Doing this could make them have to stay out of work for longer than they would have needed to if they had just taken a rest day. Another side effect is that it can cause high levels of anxiety. This can lead to lack of concentration and also shakiness. If this happens to a heptathlete in events such as the shot put or javelin, it could cost them their throw. If they're feeling shaky before a throw, it can make your muscles become weak. This is a disadvantage to the athlete because if their muscles are weaker, it will stop them being able to generate the maximal muscle contraction, preventing the athlete from throwing so far.